Can you remember when and why you decided to pursue a career in the healthcare sector?
My children had left home, they were teenagers, and I decided to pursue a Bachelor in Nursing. I enrolled, I was doing quite well. I was 2 months into the course and found I was pregnant with my youngest child. I was very unwell, so I had to give up my nursing. But when she was old enough and I decided that it was time for me to get it back out there, I ended up working in a hospice and palliative care and with aged care and dementia, and I really enjoyed it. So this is what I continued to do until we moved to Australia, and I started working in dementia again and also in disability, and I really enjoyed the interaction with people, so this is what brought me here.
What's your current position at TDHS and what was your pathway to the role?
My current position at Timboon Health is Community Care Supervisor, and my pathway to this role entailed in New Zealand. I did some courses and in aged care and dementia, and then we moved to Australia. We were in New Zealand at the time. We moved to Australia and I found that my qualifications I had in New Zealand weren't relevant in Australia, so I started training again. I became an aged care worker, and then I went on to be a disability support worker, and I've also done a course in phlebotomy and a pathology assistant, so I'm qualified to do that, but that's not needed in my current role. So yeah, here I am. I was working as a community care worker for Timboon, which I thoroughly enjoyed. Very challenging at times, but I love interacting with people. And the position came up for a community care supervisor. I didn't think I was qualified for the role, but I was encouraged to apply, and I applied, and here I am. I'm relatively new in the position, but I'm enjoying it. I really am.
Why do you enjoy working in the healthcare sector in Timboon?
I enjoy working in the healthcare sector in Timboon. We've only recently moved to the area 2 years ago, and it's enabled me to meet lots of people. I enjoy the fact that we're encouraging people to stay in their own homes and we're giving them the skills and the assistance to do that. Yeah, and I just enjoy working in Timboon. It's a lovely place, it's a close-knit community, everybody knows everybody.
Explain a typical day for you at TDHS.
So I'll start in the morning, quite early, 7:30. Come into the office, I check the emails, make sure everybody's rostered on to where they should be rostered on. I take care of all the data and make sure everybody's supposed to be where they're going. And then I will just put things into the computer, answer phone calls, deal with clients, deal with staff, do quite a bit of that. And then I'll have a break for lunch. And then I'll come back in and I'll do some more, answering phone calls and just making sure everybody's where they should be and that everybody's getting the help that they need.
What would you say to someone thinking about a career as a health or care worker?
Okay, for somebody thinking of going into a healthcare role, I would encourage it. I would. It's very rewarding. It's enabling people to stay in their own home. No day's exactly the same. They're all different. And you will put a lot of hats on, you will do different things. I would really recommend going for a healthcare role, especially in aged care. It involves disability, it can involve lots of different sectors. You're dealing with a wide variety of people and ages. So yeah, I would highly recommend it.